We do see an increase in autoimmune diseases, I think across all ages. You mentioned you had like an impending one. My husband had Crohn's, just got cleared of it actually last fall, which is amazing. And one of the questions that came in was about Crohn's disease in kids. Like, is a GAPS diet safe for kids? Just how to kind of care for it. And I hope we can expand that to any autoimmune disease that's happening in a family. Are there certain just things to look for and things to do from a functional perspective?
There is a sort of a general autoimmune. There's a couple different protocols. People may have heard of the Walls protocol. Dr. Walls is a pretty famous doctor now that got MS and was able to pretty successfully reverse that. She has a very
She was in a wheelchair for 4 years.
Yeah, and she has a pretty detailed book that goes into all that. So there's like sort of what people call the AIP or the autoimmune protocol, and that's like a generalized autoimmune diet that tends to be good for most people. And there's certain things that again are healthy foods for some people, but for people with autoimmune, maybe they're a trigger. And there's also something similar for thyroid. So there's certain foods that are healthy. In the autoimmune, there's nightshades, so things like tomatoes and things like that may be healthy for some people, but for people with autoimmune, they may be a trigger. So there are specific diets that you can look into that are for general anti-inflammatory. I would think GAPS is pretty restrictive, so I think I'd be cautious with that in kids.